Damon, thank you for taking time to come down here. I know you're super busy. I really appreciate it.
Thanks for having me.
So here's the deal. We got two different things to talk about today. And I was thinking about the possibilities of weaving these together or doing them separately. One is your opinion as just a medical doctor is one of the most sought after opinions on the West Coast. And everybody knows that. But you're also a fight doctor, and you've worked really hard for 23 or so years to earn a spot in Vegas to do the big events. I kind of don't want to weave them together just because I think people that really want to hear the juice on that and how you got there, again, we'll do a little recap. I want to keep them separate. So for those of you listening in, there's going to be the general medical one where he dumbs things down for me. I see right across the table, he brought his crayons, which you have to do. If you're going to explain things to me, you got to bring crayons. You got to use $3 words, no $12 words today. You dumb it down for the mechanic, I'll understand what's going on. Can you please tell me, I feel bad that I don't know this. I should already know this. I don't have any, I know you went to CSUN, but I don't know where you graduated, where you got your degrees, where you did your internship. I'm kind of lost on that. So help me out. Give me like you were applying for a job with a resume. What would you come up with?
We talked about it last time, but you're just going over it for the
Thanks for pointing out my stupidity there. He's like, look, Demi, we did this before. Yes, I know, but
because I called it Cal State Nowhere. Cal State, right, because that was what we called it it was my last choice to get in from high school.
Right.
And it just kind of was like one of those givens. I tried to go. I was aiming high, and I went really low. I mean, it turned out okay.
Yeah.
We're good.
No, let me ask you that. Is there a difference when you're just getting your basic classes done, your core classes done? I mean, is there a difference between Harvard and CSUN?
So I was working 60 hours a week at various places, but mostly at the Burbank Airport VSP parking. And it was actually a pretty good paying job. It was $10 an hour plus tips. So it was hard to give that up. And I was paying for school. So I was taking some courses at Glendale College that was even less expensive to see if I can get through and knock that out. It just didn't work out so well. So I stayed at CSUN.
But when you're doing your core classes, are they the same everywhere basically, or does it really make a difference?
They transfer over for the most part. Some community college courses don't, but I looked into it first and said I want to take this and get that out of the way.
Do you have any degrees or certificates that are pretty rare that a lot of doctors don't bother getting? That is there a certain level when you max out and there's certain things you can get? Because I know you travel a lot and you've been to a lot of seminars. Some you've given the seminars on.
So that's just like everybody goes to the same sort of, whether you go to Stanford or you go to Western University of Health Sciences in Pomona, like I did.
Right.
We have I went to an osteopathic medical school. I don't know if you know that, but that's DO versus MD. So
you better tell me what those are. I don't know. I know what MD, medical doctor.
Yep.
Okay.
And then doctor of osteopathic medicine.
Okay. All right.
So we were taught what MDs were taught in medical school. In addition to that, we learned to use certain modalities like physical therapists. So Marcy and I speak the same language.
Oh, yeah. That's MarcyZavala.com. That's his wife. Yeah. For those of you that don't know, but most of you already knew that.
Right. So she understands the language I speak in that and vice versa. So we learn crossover because I was really interested in sports medicine. And Cal State Northridge, I earned a degree in kinesiology, but it was a special major for sports medicine. Oh. That's what it says on the
Chinnick's mom, are you familiar with that sports medicine being an angle you can take? And do you need me to educate you on why CSUN, California State University of Northridge, would be the exact place you'd go for sports medicine? I can help you out with that. I'm going to do it right now. That's where they filmed The Karate Kid.
They did.
They filmed The Karate Kid, the final fight scenes at Cal State. Where else would you go for your sports medicine degree than where the Karate Kid did his tournament. And Mr. Miyagi fixed him with his special Okinawa sports medicine right there.
Little did I know it was combat sports back then. Had no idea.
Full contact, yeah.
Full contact, yeah.
Well, so, in medicine, I got to tell you, I was a mechanic for many years, dumb mechanic in the middle of the desert. And I literally had to have patience with customers because I had to get through all of their diagnosis, all of their scenarios, all their stories, and then we can start talking about what's wrong with your car, why it's behaving this way, and what we need to do to fix it. I got to figure it's similar with you. I got to figure a little bit is like that with people, when you're listening to, it hurts right back here on my neck, but only when I'm drinking coffee in my left hand on a rainy day, looking out that window. There has to be some of that.
Yeah, it really is. It's, I think people get a little pissed off every time they say, I'll get a text, I'll get a long text and it will be just a bunch of, symptoms and, just like throwing things out there.
Right.
And at the end it's your thoughts. And I don't want to offend anybody, but when they do that to me, but your thoughts. Well,
are you tempted to type back, say, don't text me 37
Well, it's not. No. I have different questions on each one of those things you just said. So I've got to go back. My thoughts are, I need to know more.
Right.
And so when I ask these questions, people are just like, well, just, cut to the chase. Give me the answer. I don't have the answer. I have to, dig in. And then if you withhold information, like 5-hour energy drinks, and I don't know that.
Yeah.
Right. Then what do I do with that?
Right. Listen, I have to clear the air again. I got to say this out loud again, because I think you're a little bit more of a hard-ass doctor towards me because you know me, because you say things like, okay, look, you held out on me. Yeah, you lied. You kept that. I didn't. We were talking about what I intake, food and food and drink. So I gave him a list. Here's what I'm eating. Here's what I'm drinking. I thought that covered it. He says, what medicines are you currently taking? And tell him, here's my medicines. He finds out a year later, he goes, you've been taking 5 hours? I go, yeah, 2 a day. He goes, since for how long? I go, I don't know. When did they invent them? Because kind of right then, So, I don't know, 12 years. He goes, well, he got upset. He's like, why didn't you tell me? You held out on me. You held that back. You didn't tell me. No. That wasn't a question. For me, that didn't fall into the category of food or drink or medicine. It was, I don't know. I probably didn't tell you if I was drinking coffee. I probably wouldn't have known that was a thing to tell you.
Yeah, but it's like that. It's just what I was just saying. You're giving me pieces and you want me to figure something out, but you leave out important pieces.
Well, I will tell you, Damon and I have been fighting, like I brought up before.
Fighting?
No. We fight with each other. We not against each other. We've been fighting a problem.
Okay.
I've had a weird gut pain for over 2 years that we couldn't solve. And of course, Doc comes in and does all the tests and rules out anything that can kill me, harmful. Okay, you're not dying. There's no diseases. There's no cancers. Okay, now let's move on and figure out what it is. And you immediately started leaning towards diet. That was your first thing, was what I was eating. It wasn't until it was kind of an accident that you figured out I was taking 5 hours is when I had a different pain on my side upper, and you went, okay, this could be something you got to watch. You might be in trouble here. So we worked through that. But when you gave me the medicine to help that, and you stumbled across the fact, you said cut to 5 hours, and I did. Stop taking them. For this new side pain thing I was feeling, the gut pain has gone away. I don't know what it was. I don't know if the antibiotic and the medicine that you were giving me also cured it, or whether it was the 5 hours that it just eating a hole in my gut. But boy, I'll tell you what.
It's a good way of explaining it. Yeah.
Whatever one of those two was, because that's there was, okay, let me back up. There was a few corrections you made when you thought I might be in serious trouble. You said, look, we need to address this now. You could be heading down a path here. And remember, this is over the phone, and you were out of the state. You were doing this over the phone, getting as much as you could. But you gave me some antibiotics. You told me to cut the 5 hours. You had me the bone broth. You put me on the bone broth thing to build up my guts, my intestines. Those are the only 3 things that changed. It's like, okay, we're doing that's different right now. And the gut pain that I've been fighting for 2 years is gone. Almost nothing. And like I mentioned, the one
until
time
you take another 5 hours.
Here we go. I got lonely. I got desperate. I got low one day, and I couldn't get to the back door of Glory Cloud Coffee to get Darla's prescription out of the back door. So I saw that 5-hour energy, and I took it. Actually, you want to know the truth? I only took half. I was trying to stay awake. I took half, and the next day my gut came back. And then when I stopped,
I won't say it.
It went away. I just didn't. I mean, it hurt so bad. The next day, I ran and told my wife. I go, "You're not going to believe this. I took half of one, and it tore me up. My gut, it was hurting. I don't know what it was.
Show you're doing 2. I mean,
2 a day.
Yeah.
Yeah, there was 2 a day for, I'm going to say 12 years.
That, how long you've been doing that? It's just,
yeah,
it doesn't happen overnight.
No, it took, once you switched me out, I want to say 2.5 weeks before it started with building with the bone broth and getting rid of that. Just that. I've had people call and ask me about that now because we've mentioned it during the podcast and stuff. And I go, look, man, I don't know what it's like for everybody, but this was just what worked for me. But cutting out those 5 hours made a huge difference in what I was have going on, which leads me to my next question. How on earth can you be a doctor in today's age when there's social media, WebMD, and the people call you and go, hey, Dr. Zavala, this fixed my mom. My mom, quit telling me, you telling me I can't have this kind of coffee? Well, my mom's been drinking coffee for 30 years. How come I can't have it? Or my mom started eating an orange a day and she's healthy. Is it true basically that there are different things that affect people differently? How do you get around that with customers or patients? Sorry, patients.
Genetics, DNA. I mean, everyone's different. And you can't it's not a one size fits all.
Yeah, but how do you convince someone of that when they're looking at you going, hey, man?
You got to start over. You got to start from the beginning and do the testing like we did with Mary and, looking into those pieces and then eliminating. So it really starts with an elimination. What I mean by that is elimination diet. So you eliminate all the things that it could be,
right,
and get rid of all the, the extra supplements and the things you're doing.
Sure.
And really clean it up. And when people call eating clean, that means something different for everybody. So eating clean may be vegan for somebody, and carnivore for someone else. Could be polar opposites. So you clean it up in the way I feel it's cleaning up, right? Eliminating certain things, gluten, dairy. And
well, you have something to look at. You have medical results of tests to start with.
But that's even before. So So you will usually do that concurrently, get some, deep dive lab tests and then clean up the diet and then kind of do it at the same time. Would you say
with an average person with average problems that when you do your, you choose what blood work and what medical workups you have done on each person, you choose what you're doing there. But what would you say your percentage is of being able to correct most common things wrong with most people? Is that it's got to be a pretty high rate.
Yeah, that's a pretty general statement, but
yeah.
I think we're able to improve 100% of people, if that makes sense. As far as cure, there's a certain population we work with. It's called dysautonomia, and it usually starts with hypermobile Ehlers-Danlos syndrome, which is just loose joints. And with that comes a lot of other diagnoses like POTS and some other things that people might have heard of. But when we start looking at that, when I start seeing that, I start going down a whole different line of questioning. And those types of patients will not react to the same thing that you might improve with certain.
And how many out of 10 is that? How many out of 10 patients do you run into that have that go down that path?
It's mostly women that we find, but we're finding Marcy and I will be on a plane and diagnose somebody on a plane. Just people we're running into.
Sure.
They'll mention some certain things that, just kind of triggers, and all of a sudden, hey, are you pretty flexible? And we'll have them take their thumb to their forearm, like that's as far as it should go.
Right.
And then all of a sudden, they're going right here, and that's easy.
Wow.
So, and then we're like, and we look at each other and we start the line of questioning. And
now you just chose a road to go down.
It's just because it's a certain syndrome that, you asked the first question was, where did I go to school and what did I learn and those kind of things. You don't learn that in medical school. Whether you went to Stanford or, Western
Wherever,
University
yeah.
of Health Sciences, we did not learn that. They don't learn nutrition. So any sort of doctor that knows nutrition had to learn that later on with their own.
How could that not be a foundation? I don't understand that.
It is now, but here's what's happening now. So my niece went to UNLV, and their curriculum is, a vegan diet, basically plant-based diet. So that's what they're learning. So they are getting the education now, but it's I don't want to.
No, but it seems like it's going to be a very narrow look at it if that's all they're learning.
I wouldn't say narrow. It's biased. I mean, we learned in COVID that medicine turned into a red and blue thing, and this is a little bit on the lines of that.
I don't even know what to make of COVID. I'm not a doctor. You hear stories all the time. There were some people that I had contact with, but you're right. In hospitals. I mean, higher up in hospitals, I knew some people that were working there that had been there 20 some years. And when it came down to COVID, you're right. It came down to like politics. Mm-hmm. And I couldn't believe what some of the stuff I was hearing. I'll give you one small example. I knew a lady that worked high up in administration. And one of her things was to oversee, she was just checking because she was curious. During COVID, there was a lot of subsidies coming in from the government for hospitals. And they're like, well, if you're dealing with COVID stuff, we'll help you out. If you're dealing with COVID, we'll get you covered, Mm-hmm. So they were labeling everything a COVID death. Mm-hmm. If a guy died in a motorcycle accident, but he happened to have COVID, they listed it as COVID as part of the death. And she was reading me some of the stuff, and she's like, this is just dumb. But it's the way to get the money. And it was a money thing. It was a political thing. It was a red and blue thing. No, she didn't make a big deal about it. She did her job and went on. But there were some things like that I learned. And I didn't run out there and spout them. Wouldn't have done any good anyway. But I can't. You're right. I can't believe that it went that way. So much of it.
I heard that stuff was going on, and then I worked at a certain hospital, which I will not name, and there was a death that was not related to COVID, and I was being asked to code it as that. And so I'm the last person you're going to ask to do that. and so it was probably the demise of me working there, which is fine. I sleep well at night. So that was absolutely happened to me.
I take it you said no.
Oh, absolutely. Oh yeah, of course. I was, but shortly thereafter I wasn't working there. So it really, money does crazy things to everybody, and so that's, it's just that's what medicine is now. It's an insurance shell game. That's all it is. It's coding a certain way, and then once everyone figures that out, they actually have lectures to bring you back to another summit or conference to learn how to code a certain way so you can maximize.
Really?
Oh, yeah.
Maximizing profits.
Maximizing. Well, and from the physician's side, it's not necessarily maximizing profits.
No, but it seems like the insurance company.
It's maximizing or decreasing your losses.
Oh.
See, they look at a way to ding you and take away money. And so if you want to just get paid, 80% of what they should, which is, it never goes to 100.
Right.
If you want to get the 80, you don't want to be down at 40. And if you're not coding correctly, you'll be at that 40 real quick.
Well, here's a all right. This is a dumb mechanic in the middle of the desert question that everyone would want to know. And I'm not lumping you on the insurance side of things. I'm asking you, maybe you can explain it. How come a hip replacement costs more in New York than it does in Oklahoma? You get a hip replacement, it's like, oh, it's going to be $40,000. You got to get your money, get your insurance, get your stuff. And this guy's like, yeah, it's $8,000 over here. Why?
Well, look, I mean, that's pretty easy to answer. I mean, the rent. What's the rent in a 600 square foot apartment in New York versus Oklahoma?
You can't charge what you're doing for someone by your rent.
Absolutely, they're covering their costs. Yeah. So I mean, you go to a fancy mall and you're going to be paying extra for that rent. Okay.
Fixing cars. If I had to fix cars in San Francisco, mechanics get paid a lot more money and the shop charges a lot more by hour. But you know what they don't charge a lot for? The parts. You're going to buy starters and alternators and spark plugs and brakes. They're basically the same price, whether you're in Wichita, Kansas, or whether you're in, there's a little bit of a difference, but not much. The labor can be a little bit because of the rent, but my God.
Tylenol is a couple cents over the counter. It's $500 in the hospital. I mean, how do you
I don't know. And then something just came out. Trump murmured the other day. He's like, yeah, if you guys, first of all, he came out and said, if Obamacare works so well, why are we subsidizing it? If it's working, why are we paying for it? And if we're going to pay for it, let's take this $80 billion. Let's not give it to the insurance companies. Let's just give it right to the people. Let them pay their own bills. Right. Here's your money. Go shop around, get the best deal you can.
It's all messed up. I don't take insurance for a reason. And it's just because it's a pain.
Wow. That's just, boy, we could spend 6 hours on just that topic there. All right. I do want to ask you something. You might have a tough time answering this, and not because you don't know it. It's just a little bit uncomfortable to talk about. But a lot of people I believe it or not, I put a post up and people have been sending me messages on what to ask you. More than we could ever cover. There's so many people, but and most of them are with the fight doctor stuff. So we'll get to that next segment. How far into being a doctor? I'm hoping it was a very long time, but how far into it before you lost a patient?
Oh gosh. Internship. So in medical school, if you're losing a patient, you're doing something wrong because you're just shadowing. You're not in charge. But when you get so after 4 years in medical school, 2 years are in a classroom, 2 years are out kind of traveling around and doing clinical rotations in different specialties to find out what you like or don't like.
Sure.
In my case, it was what I didn't like. It was OB-GYN and pediatrics, so it wasn't my thing. So I went internal medicine. So when you get into a residency, the first year is called internship.
Okay.
And the internship year, you are, come July 1, you are a doctor now, right? You graduated,
right?
You got the white coat ceremony, and now all of a sudden you're a full-fledged doctor, and you're in charge of patients,
right?
And you're thrown to the wolves, and that's why people always say you don't go to a hospital or a teaching hospital in July, August, September. It's because you're going to get a brand new intern. Well, right. It's true.
I got you.
So it's practice for a reason. So you have to kind of learn. When someone loses a patient, sometimes it happens. I mean, they were going to.
Yeah.
You could have been, Dr. Oz, my favorite guy. It could have been Dr. Oz taking care of that patient, or it could have been the intern.
Right.
And they would have passed. Now, if you're asking me if I did something to.
No, I'm asking if you remember it.
Oh,
because I would be willing to bet you remember the first one.
Yeah. So I do so many different things now. When I first started, I'm doing hospice now. And so hospice was something I got very comfortable with in the hospital, just because people were coming in,
right.
and not because it was more dangerous in the hospital per se, but it was people really didn't want to die at home, which I understand. So
I've never heard that. I've always heard that people wanted to be home. Well,
no, that's true. There are some people, but it's just not. If you're by yourself or you have somebody that just can't take care of you, what do you do?
Sure.
They can't push the medications. They're not equipped to take care of you. So if you're in the hospital, you're in a bed, you got nurses, you got a button.
Someone's paying attention to you all the time.
Someone's paying attention to you,
hopefully.
And so, I saw a lot of death. And a lot of times we instituted comfort care measures in the hospital. So it was basically, having a talk with them and talking with, at that point it's probably family members, and just saying there's really no point, there's
Sure.
a way to say it. I mean, in different situations, maybe it's metastatic cancer or something like that. There's just really no hope, and they failed, all the conventional treatment.
Even with the way you described it, even being in a hospital, nurses and other doctors around and people around, and I could see now, I had never thought of that. I couldn't see someone wanting to be in a hospital, ever want to be home in their own bed and comfortable. But if you are alone, that's a terrible thing. I didn't even think about that. But I bet even in your situation, when that first happened the first few times, you probably had to figure out a way, something they don't teach you in college, is how to compartmentalize that. Mm-hmm. Because you literally have an ex-patient who needs you right now. You can't be sitting here, with your mind twisted on this because you're really emotionally attached, and you got to find a way to keep going.
Well, this is where you separate. You could have top of the class folks coming out of medical school, going into residency, and they're really smart, There's no question they're going to get 100% on a test, but the test of life when they're in a situation with their patients, and usually, again, generalization, surgeons, really top-notch folks came out of Stanford, Harvard, and trained. They come in. They might be really brilliant, but when it comes down to end-of-life situations or talking to them about
bedside manner, just
dumbing down, $2 words, those things, it's just not in their vocabulary. They're just they're so up here that they don't know how to get here. And what I say, and it sounds cheesy, is just meet the patient where they are. So if someone is, dying, you gotta meet them there. So it's something that I learned over time. It didn't happen, in the beginning. It was tough, right? That's a kind of a shock, and you remember those times. But I've gotten better to find out. Okay, let's just block out the rest. What do you need? Sure. Because the other part of that was I was up in Idaho visiting my dad, surprised him for his 80th birthday, 6-7 years ago, and I got my appendix burst. So I was in a foreign place. I was in northern Idaho in the local hospital there, and I became a patient. And I had 104 temperature for 3 days straight before they knew what was going on.
Wow.
So I was when I came out of my stupor and trying to really just kind of playing doctor on myself, just going, this isn't right. We're not going in the right direction. Let's change up antibiotics. Let's do all these other things. So every single night when I would push that, I had this headache that would not go away. I was miserable. I'm pushing the button. People wouldn't come to me. It was freezing cold in there because and then I would become super hot, but just back and forth. I was miserable. I just wanted a blanket, and I couldn't get that. So after that time in the hospital, I came back to do my doctoring here in the hospital. First thing out of my mouth, were you comfortable last night?
Wow.
Did you have people answering your call button?
I get it.
What's the temperature like?
No, I get it. I do.
It was those things, and they're kind of looking at me, and they're like, "Oh, well, yeah. I mean, that's not your problem." I go, "No. Tell me, what was it like? Wow. And are you being treated, fairly here? And
you've probably been that way since that day. Every time now,
it really was eye opening. And things happen for a reason. It's probably that. I mean, it was later in my career, but it still changed me.
Do you ever feel like sometimes I would guess with how many years you've been doing this, you probably lost patients. It just happens. But how do you rationalize, or how do you compartmentalize, or how do you deal with when you lose someone, maybe a patient you've known for a few years, and they could have saved themselves, but they just wouldn't listen to you. They wouldn't change what they ate. They wouldn't stay faithful to the medicines. What do you do with that?
Well, that's tough. That's a tough one. I don't. It's really the compartmentalizing myself is. Do I lose sleep at night? Yeah. Knowing that they're doing that or not, and I can't take on what they're doing to themselves and make that affect me. So,
well, you're not supposed to. No.
Well, I mean, as long as I have it out there, like I've told them, this isn't the way to, and I have sounds like a lot of do's and don'ts, but once you have that, but if it's someone is pretty serious off, like, in your case, would you have that situation on the left side? Yeah. I told you, and I think you knew from where I was coming at you that I was, we're not messing around here.
Yeah, you made it very clear. It was a different tone you had with me. Like, hey, I'm telling you something, and you need to listen. And I was like, all right, what's up? And you're like, you could be in a lot of trouble here, and we got to steer you away right now. Yep. Or, you're going to be in the hospital, and this may be one you may not come out of. So pay attention. And I did. Yeah.
And if you didn't change or didn't follow my instructions at that time, it would be, and you went down and, look what you're doing, not to yourself, but to your wife and your kids. Well, that's what I look at. I look at the whole picture, and you're not just, this is a selfish act here. Right. And so I can get pissed at times, but I'm not going to say that to the patient. It's just, so here's what I do in my concierge practice is I meet with families first or patients first,
Right.
to try to get a sense of, how much are they going to buy into this,
Right.
and what they're going to do. I will. Well, I want to go down that.
Well, you
road,
don't want to fight. You don't want to interview somebody and go, "I'm going to be fighting with this guy every day."
Well, that's right, and I get a sense of that. And sometimes I'll be, I didn't make the right choice, but it's just it works out in the end.
Right.
But, that's something I really look at to find out if they're going to buy in.
Moving to another area that we had you and I have kind of discussed some little things before, off and on camera, but. We were talking. I was talking to you a little, and we touched on this about 30 minutes ago. It's like if you get a patient who insists that they know how to fix part of their problem, like, okay, you can give me the medicine, you can do the diagnosis, but I'm telling you, if I cut my oranges into 8 slices and I eat one every 13 minutes, it's really fixing me, and I feel better. You had mentioned something the other day. You said. About like a placebo effect. You go, yeah, if they're happy with what they're doing, I let them go. I mean,
Right.
if the oranges aren't hurting anybody,
Right. As long as they're not hurting themselves.
why tell them those are not doing anything for you?
Knock yourself out.
Yeah.
Yeah. Placebo works 30% and go for it.
That I got stuck on that number when you told me that. Mm-hmm. I mean, I'm driving going 30%. That is a huge thing for someone to believe about themselves, And and it's working, if they think it's working and you let it go, is that just part of the attitude, the motivation, the drive? It's like, okay, if that's driving you in the right direction, go ahead and go.
I wish I knew. I know the attitude is huge. I know that your positive mind and all that, I know that there's people that really focus on that, and I think a little woo-woo and out there, but it's, if you have negativity kills.
Sure.
And so if the opposite, helps, go for it.
Well, just so you guys know, talking to Thomas and my lovely bride over there's some things that I don't tell Dr. McDreamy because I know he's going to make fun of me, because I know he's going to have this attitude of that I'm woo-woo, that I'm psycho. And there are times when I'm eating my Fruit Loops, I will pick out all the green ones because I know the green ones are a problem. And I know I feel better if I don't eat a bowl of Fruit Loops with the green ones. You think I'm going to tell him that? No, just leave that part out.
Fruit Loops are on the pyramid now, the food pyramid now. So I guess you're okay with that.
All right, here's another dumb question for all the dumb mechanics out there in the world. First of all, can you take aspirin and rub it where it hurts on the outside and have it go right to the pain in my elbow? Can I rub it right there?
Are you serious right now?
Yeah, because people do that. They'll even take, when I was a mechanic, they told me if my joints hurt when I was a young mechanic. Hold on, why is everyone in the room is laughing at me right now? I'm not kidding. Okay, if you get stuff absorbing into your skin, if I put poison right here, don't know, poison will absorb into your skin. Yeah, I know, so will an aspirin. I'm just saying, when I was a mechanic, there was old mechanics that said if your joints hurt, you spray WD-40 on the outside. I'm like, that can't work. And why would I want WD-40 working its way inside of me? But there are still people that say...
laughing. They're laughing at you when they told you that when you went to do it. Yeah, okay, I get what you mean. There are some chemicals, medications that have a certain, balm, salve, ointment, cream that work in the area. That will work in the area.
Okay. See? Well, you two shut up. Don't laugh at me over there.
Up aspirin. Okay. So, but the question I get usually is like, how does aspirin, when you take it, not rub it on, know where to go to fix the problem?
Okay. Look,
is that where you're going?
Yeah, that was my second question. Was, does aspirin go to this point, or does it block some pain receptor in my brain?
Right. So so every medication has a mechanism of action, and it's the pharmacology of what it does.
All right.
So they have properties of what they'll do in the body. So if you're blocking pain receptors, it knows to go that. But just because you don't have pain in your knee and you got a headache and it works for the headache didn't mean it didn't help for the knee.
That's what I was going to ask. Is that it kind of...
So it gets absorbed.
Okay, then how come some medication says this is pain? Why isn't there just one pill that says pain relief then? Why is there one that says this works better on headaches, this works better on joints?
So there's different types of pain and where it comes from. So most people that say back pain are really complaining about a spasm of their back.
Okay.
It's painful, but what is the mechanism of that? And so giving you a muscle relaxer like Robaxin is what I use will help take the spasm and relieve that, which takes away the pain, not necessarily a pain pill. You'll go to the ER and you're going to get shot up with, Dilaudid and morphine and Valium and all these things. So they're just kind of throwing the kitchen sink at you because they want you to get better and they want their scores to be really nice.
Moving right along.
It's like the waitress or the waiter that comes to you at the end of your meal and really is really nice trying to get that tip. So that's what happens.
All right. Well, so that leads me into sunny point number 2. And we touched on this a little bit, and then my wife shut us up so we could save it for the interview, of course. But I always take, when she tells me, here, you taking this pill because the bottle says, for an adult, take 3. I'm like, okay, well, I'm huge. Give me 6 because I'm bigger. So does an aspirin or does a Tylenol, does it work the same on everybody?
For the most part, yes. But yes, you're right. There are some things that have to be based on, milligrams per kilogram or whatever.
Absorption, like how big I am?
Well, it takes into account the size of the patient. So you're right. But that's usually kind of like steady state levels of antibiotics trying to get you to, that kill factor of an antibiotic, not necessarily, usually the rule of thumb in medicine is the lowest effective dose. So you don't, I know a lot of people, if I tell them to take 1, the way they operate is they're going to take 2 or 3.
Sure.
And not just because they are bigger or whatever.
You want to get it done.
They're just aggro in that respect. So I get that, but no, it doesn't work quite the way you're saying.
No, yeah, and that's why I'm asking, because that's always been with me when I've always been a big guy. It's like, well, just give me more because I'm eating for 2 here, and I gotta have more of it. But then that goes back to what we're talking about the last time before Thomas totally screwed up our interview with a terrible studio. Thomas, I want you to live in shame over there on that couch for 5 solid minutes.
Wasn't his fault.
It was completely his fault. This is his area of expertise. When you look, you said there's actually a way to calculate on the side of medicine how much you take for how. What is the math on that? Just so I'm saying it right.
So there's an app for that, and the app is Hippocrates is what I use, and it has a half-life. So each medication has a half-life, and so you had asked me before, when is that medication out of your system?
Right.
And I said that's 4 half-lives. So what you do is go to the app, look and see what the half-life is and multiply it times 4, and that's out of your system for the most part. Unless you have bad liver disease or kidney function where it's not going to excrete it.
Because that's one question I've always had is like, well, how long until something's out of your system before you can take more or before you can take something else? And I would have no way of knowing. It's like, well, it must be out of my system. My pain still hurts. My neck pain is still back.
Well, that's why there's still doctors. Yeah. just don't try to do it yourself. I'm going to give you all this information, and here we are. No,
there's going to be people.
Just keep asking your questions.
Yeah, there's people writing this stuff down, listen to the interview, go, I got it now, man. I'm good to go. We're getting all the important information here.
AI is going to take over.
All right, let me jump over to caffeine. That is a serious topic because I'm a caffeine guy. I'm trying to figure some stuff out here. When I stopped the 5 hours, I was miserable. I mean, for, days and days and days, I could not wake up. I had no energy. I couldn't do anything. It was like tough. And my wife is like, well, what was that yellow can stuff? Yorba Linda?
No.
Much. Mate.
I always go, give me a can of Yorba Linda, which, by the way, is gross. I don't know why you keep giving me the grossest stuff to try.
I didn't give it to you. She did.
The yuck, no, that came from you. The yuck water came from you. The Yorba Linda stuff came from you. It is the most terrible stuff, which usually for me, as a dumb mechanic of my age, usually means it's working. If something's horrible, it's like, well, that must be working. That's gross stuff. No one's eating this for pleasure. This is obviously working. So those, what are they called again? Yerba mate. All right, so I'm pounding those things, and they're gross. Didn't wake me up at all. I go find something else. So then, I'll take 2 cans, and then she was getting me Starbucks cans of little. There was different milligrams of caffeine, and those were gross too. And I'm trying to wake up with those. And as time went on, and I got the 5 hour away from me, got that out of my system, and now I'm kind of just, all right, this is my baseline now. I found that there was a big thing of cold Starbucks you could get, and I'd have to drink 2 of them to have the same amount of caffeine that was in a a 5 hour, but now I got to drink 30 ounces of liquid to get what I was getting in this.
Okay.
But number one, those didn't give me my gut pain, and they didn't work.
Okay.
So when I'm looking at the milligrams in a 5 hour to wake my ass up,
Yeah.
how do I translate that to other stuff? Since I can't have these, how do I? Is it?
You took caffeine for so long that your body now you're super saturating all those receptors, and you got to take more and more and more to get the same effect you had before when you took one.
So, but is it a fair translation? If something says there's this many milligrams of caffeine, is that accurate the other way too? Like, yeah, they're all about the same, or is like, no, that says it's the same number as this, but it's way different.
I think 100 milligrams of caffeine is the same whether you get it in mate or not. But yeah, I just think that if you're finding yourself having to go to that well all the time,
yeah,
that's a problem.
He's going to go back to eating. He's going to give me the protein thing.
It is. No, it is. And some people, if your liver isn't healthy, and that's another loose term, bogged down, if it's congested because of people not eating right, you actually can get the opposite effect with caffeine. You can actually just crash.
Really?
Yeah. So some people, that's why this one size fits all thing doesn't work. I mean, you just don't know. Some people, oh, you're out of your mind. Caffeine doesn't work. Well, let's check out your liver.
Yeah.
And, let's see and clean that up. And all of a sudden now caffeine's working.
I had no idea that was a gig. I had no idea. Now, like you say, everybody's different. You got to find out where everybody's at.
Right.
She's got me down to a routine now where I can take 2 of those little ones and I'm kind of awake. I'm like better. I'm focused.
You're talking about the little Starbucks
things.
Okay.
Yeah, little cans, and I could take 2 of those, and like it is not like a 5-hour energy pops me.
Okay, now you're just trading one problem for another. So,
but I have no gut pain with these.
It's coming.
What?
It's coming.
Oh, come on!
You have to figure out. Well, okay. Well, we got to talk offline on this, but this is you're killing me. You're killing me. You're just now I'm finding out about this. This is crazy.
Coffee. It's just it's a little can of coffee. I gotta. No, I don't know.
Read the ingredients on the back.
You know what doesn't work?
Guarantee you, there's not just 4.
Yeah, there's not just 4. I don't know if you guys caught that or not. That was in the last episode we did. Plus, I've talked about it in between times. One of the most valuable things that I think our community has taken away from you, like something that just stuck. One of those, you've passed along so much information through me and my wife through the show that we've repeated things. Mm-hmm. But one of the things that I got the most emails on, the most direct messages, was when you said, don't snack on anything that has more than 4 ingredients. And people said, what are you talking about? I said, no, listen, I thought he was full of shit too. But there's actually, you can go to places and there's chips that have 2 ingredients or 3, but it's really hard to find and they're kind of expensive. But there are things out there that don't have 75 chemicals and additives in them, and I didn't think that was possible.
Yeah, there's a caveat to that though. So someone that gets the ingredients like there's 2 or 3 in there,
right?
And then all of a sudden, oh, this must be healthy, and that's all they eat. That doesn't work.
I've never instructed anybody to do just that.
But I'm saying that
snack
people
food
will do this.
Yeah.
And so, kind of switching gears a little bit, people that eat the average American diet.
Right.
A lot of people say, oh, the vegan diet works for me. Well, there's a reason why. You got rid of all those preservatives, and now you're eating whatever is plant-based diet.
Sure.
All you did was just eliminate yourself of all the crap. But there's a honeymoon period, is like what we like to call it, for about 9 months, that things are better, and all of a sudden now you don't have all the minerals and the vitamins and everything that you need to sustain that, and all of a sudden you're becoming deficient.
Oh.
And so you're actually worse off in the long run.
I think most of the people that have chimed in about this, and I'm going to say 700 or 800 emails about it, they just replaced their chips. No more Cheetos and Fritos and stuff like that. And they went and they found something that had 2 ingredients or 3.
Or apple or a banana.
Right. Well, and I'm just speaking yes, they've done a lot of that since I went on that thing where I was eating yogurt and bananas. And I said, this is just what my breakfast has been to lose weight. And a lot of people have done that for their first meal or one meal, just switched a little bit.
You're going to open up your own clinic?
Yeah, no, I'm not. But they've just followed along out of their own because they wanted to. I didn't instruct anybody. But they're like, well, I'm not going to eat, trick cereal in the morning. I'm going to have a banana and apple every morning instead of Fruit Loops. I'm going to have this. But the other one was people that were big snack eaters. Like, you know what? I just went out and found the chips. Since Dr. McDreamy says there's chips out there, I went and found them, and that's all I buy now. That's one small thing they've changed. If they're going to have chips, if they're chip people, if they love chips, you can't stop them from eating it. I think it was a big jump from Cheetos that have 75 ingredients down to one that had 3. It can't be a bad move, and if they like it.
It's a lesser of evils, though. So if you ask me what are something, you've asked me this before, if there are any things for overall health, what could you do? That's kind of
this is coming in here, but they had their pens ready right now, pen and paper ready.
Well, if you want to go ahead and you want to ask
it, then I'll ask it because they've constantly said ask him to give us 5 things that we should quit eating and drinking, and please give us 5 things that we should. And you can make it complicated, or you can make it simple. Like the one time I asked you about this, it was just you and I talking a year ago or 2 years ago. You said soda. I asked you a question: if you could eliminate one thing from our entire country, the United States just gets rid of one thing that would help people. You didn't even hesitate. You said soda right away. If I could make that disappear, it would help people out tremendously. So
in soda, there's different, so diet soda is worse than regular soda. And everyone was like, what? What are you talking about? Because there's still people that think that calories in, calories out is the be all end all. So you understand what I'm getting at there?
I do, but they do think that too. They think if they're doing sugar-free, caffeine-free, diet, zero Coke, they're being healthy.
It's the chemical additive that they're putting in there that just attacks your nervous system. So diet sodas have that, and there's some people will do everything else, but they're still going to have. Well, I have one vice. Well, it's the diet sodas. Well, you're not going to get better.
You pick the one thing you shouldn't.
The one thing you should. Yeah. So sodas in general with diet or regular.
So what would you say were the 5 things if you could just advise average people to quit? One would be all sodas completely, right? That would be on your list. What other things would come to mind that you'd say, please don't ever do that again?
Okay, so you talked about $2 words instead of $12 words.
Please.
So I'm going to use 100 peso word here. So this is really low. If you have to unwrap your food, okay, we're not talking banana.
Right.
If you have to unwrap and there's actually writing on your food, that's a problem. Okay. That's a problem.
All right.
And no, that's taking it down because it's processed. That's the issue. It's processed. And if you're going to be eating food, we talk about well-balanced diet. You hear this all the time. Well, nutrient-dense food.
Unwrap it.
Yeah. See what I'm getting at? If you're taking it, so it's like, some bars are better than other, like as far as protein bars.
Yeah.
But there are some bars out there that are so loaded with crap that they're so unhealtty. And people think they are because of what the label says.
Everything gets unwrapped.
Well, no, it doesn't. It doesn't. A steak. You have to. Well, you
just eliminated every candy bar. You eliminated every cookie.
Oh,
you eliminated every chip possible.
Now you're getting it. The 100 peso.
There is no goddamn snack. There's no. Yeah, he's like, you could have just said anything you enjoy. Don't have that. Because that's what it's coming down to for me. That's what it feels like for me. Unwrap it. I'm trying to find something.
You haven't had a good real steak
dinner. Unwrap it. That covers so much of everything people throw in their baskets at a grocery store. I mean, I'm walking up and down a grocery store in my mind right now. I'm thinking, everything comes in a. Even if you talk about a box, the box when you open it up, it's got a wrapper in the box. It's the same thing.
Well, the box counts. So,
for Christ's sake, now boxes count too.
Well, you don't really have to people really struggle with this. And if you're talking about, it has this ingredient, is this one better than that one?
They do that, yeah.
Right? So it just will never end until you really break it down to.
It never ends. That's all they do is
real food. Now, I will tell you this, it sounds like I'm I'm not being empathetic to folks that struggle with, financial reasons and
Sure.
things of that nature. So I get that. I get that real food is more expensive. So I believe me, it's not beyond what I know here. So
Yeah.
if the ramen in Cal State Northridge, and the stuff that we just ate because it was cheaper.
Because 20 cents a styrofoam thing of it.
So I get that. So don't get pissed off at me for not understand. I do understand that.
Yeah. Well, that's just like Thomas. You go to a grocery store, right?
Sure.
And does your grocery store have a healthy section or a healthy food section?
Yes.
What does that make the rest of the store? Oh yeah. Okay, then you see where I'm going with that now. See, I'm not so dumb.
What did I tell you? You shop around
The outside versus the inside.
I thought she was full of shit.
No, it's so true.
She told me, Gen X, well, what did you say again? Tell me that was about it.
Shop around the outside.
You shop around the outside of the store, and it's
You have
more
the
healthy.
meats and the deli and the produce all around the outside. Inside is all the freezers wrapped, processed, everything else.
That just that stuck with me. You mentioned that the other day, and now I'm even thinking about it even more. If you just rule of thumb stuff,
Right.
$2 words versus $12 words. It's like
They
don't
pack at the registers.
compare. People do that. They'll make lists like, well, the riboflavin and all these other words that are in stuff, and they're like, well, this has this much and that has that, and this doesn't have that word in the ingredients, but it has that word in the ingredients over here. And you said it best. You said it never ends. You're never gonna solve that riddle. Knock it off.
And I'll break my own rule. We usually tell people, a lot of truckers who are just on the road and where do you stop? We went storm chasing with the family this year, and all we did was stop at gas stations.
Sure.
So and Marcy that's one of her things. She'll tell people, okay, this is what you have to do if you're a trucker, you're out on the road a lot. Beef jerky seems to be a good option to do.
You've told me that.
I have, and I'm breaking my rule there. You have to unwrap it, but there's just lesser of the evils.
Right. That's good. But you know what? This is something you guys have studied 20 plus years to get where you're at, where you can recognize things at your fingertips on the fly, see what's going on. I mean, to the rest of us, that's impossible. We have to get a word from a guy like you. It's just some simple stuff, some simple basic rules to try to follow, because we're never going to get 20 years of that. And plus, we can't go to school for it. So where do we get it from? The internet. Oh, well, that's not confusing.
Right.
You get 10 right things and 10 wrong things all in the same day. If we, that's why it's so important when you say these things, that if there's a way to make it simple, and like you said, not everything fits every person, but as a general rule, if everybody would quit soda, great. That's not going to be bad advice for anybody.
Yeah. If you're going to eat bread, sourdough seems to be better than most of the other ones.
Yeah.
Those are general rules.
So what would you say people should have some of? I mean, is this just going to be a fruits and vegetable discussion, or is there more to it than that? Like, if you're going to quit some things, quit soda and quit unwrapping your food. That's a big thing. That's enough, because that's going to be hard for people to figure out. But what's on the other side of the coin?
So $10 word, nutrient-dense foods. Real food. Okay. This is like I said, the steaks and the animal meats, and people get offended by that, but they're just more nutrient dense. The amount of protein in 3 ounces of steak, the amount of broccoli you have to have it's like a truckload in order to get the nutrient equivalent in that for protein. Yeah. So it is that doesn't mean broccoli's bad.
No.
Now, here's another general rule. Most people will eat that raw, and that's not good. Plants have defenses, a defense mechanism. Animals have teeth and claws, and plants have phytins or nutrients that will actually rob you of certain minerals.
Okay.
Rob you of being able to absorb the minerals. So you could read the ingredients of what is inside broccoli or plants, and it's like, well, okay, I'm going to get that. Well, you're not. Especially if you have that raw, it's not going to be absorbed. So
wait. Okay, back up. Hold the phone.
Okay.
This is an argument we have been in for our entire marriage. Mm-hmm. And I'm really upset because it sounds like I'm losing right now. Badly.
I'm sure. I don't even know, and yes, you are.
I hate when he blindly sides with her, but it happens everywhere I go. I, at some point, picked up in my brain that if you boil a vegetable, carrots, broccoli, whatever, you're boiling out all the ingredients that help you, and now you have nothing. So I'm always telling her, just give me the carrots cold. Give me the stuff cold. Let me just eat it how it came out of the ground.
Right.
And even if that doesn't taste as good, I don't care. There's more nutrients in it.
Right.
So, well, who's right here?
So you take it, for each food you're talking about, there's probably a different mechanism, but brown rice, you're taking out that sheath that has, the husk, you have to boil that away for that to be the one that's going to be robbing you of the nutrients. So that's why white rice, there's always debate, white rice or brown rice.
Right.
White in general is probably better. And most people, just like, no, because it has this, you're just taking it on paper, what the nutrients are.
Right.
And it's not how
not accounting prepared.
It's not how it's absorbed.
Yeah. Okay. I see that.
So
I can see that now.
That's why it's really tough to have these.
All right.
And I don't even argue anymore. It's just.
Why didn't you just settle
on?
You don't be an argument, but I'm right now. Cold carrots or boiled carrots? You just tell me which one.
Which
is better?
Cooked.
I know. Cooked or not cooked. Which is better for me?
Cooked.
God damn it.
Well, we already said that.
I know. What I was trying to get you to, a little man code there, a little bro code.
Oh, I see.
Just slide one in there for the gipper, just a little bit like there's, and he could have just as easily said, in the situation of carrots, you might personally be better off with them cold. That's what I'm saying. You think Bugs Bunny would lie to us? No. It's a pretty solid piece of advice there.
Those are general rules. So.
I know they are. I get that.
But if it's a raw carrot versus a Twinkie, I mean, now that's a different story.
Oh, all right. So let's make sure I got these things in because everybody had so many questions. The fans, the viewers, the followers, they have so many. You got just tons of them in there. I do have another quick question. This is, and we've already done our hour, so we'll call it here. But we got to keep doing this because I have 30 more questions that we could do. Let's go another couple weeks and do it again because these are questions from the audience that are like, ask him this. Well, we don't have time to ask everything. Gen X Mom, when we had our doctor down in California, I can't remember her, the woman doctor. She wasn't a real doctor, though. She was called something else. A what?
Nurse practitioner.
Okay. What is the difference between a nurse practitioner and a doctor, and how come a nurse practitioner could see us every day? And I finally asked one time, I said, wait a minute. When we were going there years with our family, and I went, wait a second, you're not a doctor? And she said, yeah, I'm a nurse practitioner. I said, then how are you practicing medicine and advising me on shit? How does that work in general?
You're going to get me in trouble on this. You're going to get me in trouble. So I have good friends who are nurse practitioners, and they'll tell you, my friends will tell me, they'll be the first to tell you that they didn't have the certain training that we did,
right,
or DO or MD. That doesn't mean that they're bad. So
right.
It depends, like we just talked about, you get into school and you do all the training and you're all pretty much at the same level.
Sure.
You have to do further training in nutrition or, sports or whatever it's going to be in order for you to really excel in that.
Right.
So nurse practitioners start out as nurses, right? They're bedside. They have a different, and it's not wrong. It's just, they just have a different mentality when it comes to taking care of a patient than the doctor does.
Okay.
At that point, they're not really there to diagnose or treat. They're there to take care of the patient and deliver what the doctor has ordered. Now, all of a sudden, you're getting that side of they get out of their school, and now they can actually do the diagnosis and treatment, right? So there are, and I'm not.
Well, who gave them permission to do that? I mean, I thought you had.
It's been voted. So nurse practitioners, and I don't know all the rules, but in Nevada, they can hang a shingle and be a primary care provider for you.
Now, in California, because I didn't know there was a difference for a long time, years gone by, and I'm like, okay, hold the phone. I get to ask some questions now because I didn't know this. And she explained, and I never had a problem with her as our doctor, just so you know. I thought she did a wonderful job.
Yeah.
But she said she had to operate under someone else's license. There was a name on the door, and then there was like 6 nurse practitioners that saw patients, but this guy had the ultimate responsibility, and he was the one who ordered the medications.
Physician assistants, PAs, are that way. They have to be under the doctor.
Okay.
So it's changed that nurse practitioners can be on their own. Now, I have a collaborating physician agreement with nurse practitioners for certain types of entities that require that. So if I work for another outfit and they have nurse practitioners, I can be their supervising physician.
Okay.
And so it just really, and it's more of a billing thing. We talked about that earlier.
Yeah, I was going to
It's
say.
more about how do we optimize. So a nurse practitioner in general, the most they can get is 85%. And with a physician, if I oversee that and sign off of it, they can get the full 100%.
Boy, you got to really pay attention to who's under you, though. I mean,
You do. You have to know them.
Yeah.
And there are good nurse practitioners and bad, and there are good physicians and bad.
Yeah.
I mean, it's everywhere. But I think the scary one in both realms with physicians or nurse practitioners are the ones who are cocky and will not ask for help. And they think they know more, or they, I have, now a lot of nurse practitioners are going the doctorate route. So they actually are calling themselves doctor. And so, and you have to pay or go longer. I'm not sure, again, the rules on that, but they are calling themselves doctor. And I have a little bit, I don't want to piss anybody off because I have friends that do this, but it is
a topic and it's out there.
It is, but some folks can take that and just run with it and don't ask for help and don't consult if when they should. Now, again, I'm going to go back to the physicians. It's that intern, in the hospital.
Yeah.
They're asking their senior attending and their residents for help all the time until they get to the point where they feel comfortable managing a certain disease state.
I know you as a guy, I could probably describe you to someone pretty accurately, but not your business aspect. But because of what I know about you as a guy, for knowing you for 50 years now, I'm pretty confident that if you came up against a medical situation that you were like, whoa, and there was a need for a specialist, there's a need for a guy who does just that, you'd call somebody, somebody, you're like, you know what, we're getting into something here and you've been doing this for 60 years. What do you I don't see you ever not asking for help if it's available and it's something you had a question on.
Absolutely. I was a hospitalist for 20 years. A hospitalist is a doctor that takes care of you if you're sick enough to get hospitalized, and your primary care physician usually doesn't have privileges, and it's just the way it's set up now. So I was taking care of people that I didn't know, and I would take over their care from there until while they're hospitalized.
Yeah.
And all the time, we're calling subspecialists, infectious disease, orthopedics, all this stuff. You just stay in your lane,
right?
Stay in your lane.
And if you know guys that, like in my field, I knew the best transmission guys in town. I'm like, no question. If I knew the best engine builders and machine shop, I'd go to those guys. They're better at it. That's all they do all day long.
Why wouldn't you?
Yeah. So I want to tell you, Thomas, a little side note here. First of all, this has been one of the best interviews we've ever had. This is going to be so much fun for people to listen to. I'm telling you. Okay. I know for you, you're just talking shop, but for everybody else, this is stuff you write down and you play again and you share it with people. That's how good this one was. I mean, I'm picking up on it, and I'm stupid. I guarantee people that are smarter than me that have been looking for this stuff, this was solid. However, I did have something that I brought up to him before that, he gets a little gruff, he gets a little testy about things. And I was asking one question. It's like, what is the difference between a patient and a customer? Because I had customers. When I had a car shop, I didn't have patients. A car was my patient. I had a customer. And most people have customers. You're a construction guy, you get a customer. But when you're a doctor, you get a patient. And I thought for a long time, what's the difference? Why would they Well, you give customers discounts. You didn't give a patient shit. It's like, look, motherfucker, you need to be here, okay? You're sick. You're dying. I'm here to help you. There's no discount. You're a patient. So shut up. I mean, obviously Dr. McDreamy isn't that way, but you can see the difference in the mindset between a patient and a customer. When you're a patient, you're begging for help. You're hurting. You like, fix me. When you're a customer, it's a whole different thing. You got a little mindset there. You say, well, like the steak wasn't as good as I thought. How about we take a couple bucks off that steak? Because you're a customer. There's a little more latitude there. So I didn't want you to have to stress over that, Doc. I think I got that figured out. There's the difference between a patient and a customer. Well, we got to do this again because, like I said, I got 30 more questions. I want to move on to the fight doctor stuff. But we got to come back again. We can set up a time. Now, this studio is close enough for you, right? It's a little easier for you to get in there.
Oh, yeah.
So you don't got to drive
Anywhere
very far.
in Reno's
Yeah,
easy.
but you are so busy that if I can get a studio close, you can sneak in and out. I get more time with you. So listen, we got to get out of here. Thank you, Damon, for showing up. Thanks for giving this valuable information. I know to you, you're kind of reading off the cuff here, but for the rest of us, that's huge. There's going to be so many people that you've sent them on direction. You've changed a few things because of the basics. That's what people need, and it's a huge thing. We got to get out of here. We got to go. It's been Gen X Mom. How long do you think we've been on now? Are you going to go? Did you hear the last podcast? How she gauges how long we've been on? She goes like this. Oh, let's see. That's about an hour and 15 minutes. And I go, what are you
Their back
doing?
stiffness?
Yeah. I just learned that the other day. We've been doing this 4.5 years. And she's like, well, I can tell how long I've been sitting here for.
We're at that age.
What do you think?
45 minutes.
Yeah, you're way wrong. You're not even close. Like an hour and 8 minutes. Yeah, we've gone over an hour on that. So, all right. Listen, we got to get out of here. Thank you guys for listening in. This has been Damon Zavala, the doc. He's the fight doctor also. That's what's coming up next. But for this one, this was all the general MD questions, all the stuff we got going on. I didn't even get to half of your questions. I didn't even get to half of mine. We'll do it again. I very, very, very promise. That way you guys can have something to look forward to. But everything he told you, go start doing it. Go practice it right now. Guess what? By the next time we do the next interview, you can say, okay, I got 2 or 3 weeks under my belt. I've been doing that. Give me round 2. Give me the next one. That's what we'll bring to you. We'll bring to you the next set of advice. A lot of do's and don'ts, a lot of wherefores and what have yous, a lot of ins and outs. Thank you guys for listening in. Not sure where you're chiming in from around the planet. AM, FM, Sirius XM, or perhaps you're listening in on the Armed Service Radio Network. Remember 2 things in life. Number 1, wherever you go, well, there you are. And number 2, I'll catch you guys on the flip side. I got to go. I'm out, baby.